Hello, I am Dr. Munir, Senior Consultant at Dr. Rao's ENT Hospitals. Today, let's talk about a common ENT complaint called tinnitus. Tinnitus is a symptom, it's not actually a disease. So, what is this tinnitus? Tinnitus is a noise heard in the ear which is not actually present in the environment or the surroundings. So, it can be caused by a simple earwax problem to a more complex neurological disorders. So, very commonly we see in our OPD like the conditions of the middle ear like otitis media, middle ear effusions owing to eustachian tube dysfunctions, a very common observation for the cause of the tinnitus. But there are also certain conditions like glomus tumor, otosclerosis, which are very complex and difficult to identify and diagnose. So, inner ear conditions like noise induced hearing losses or labyrinthitis, Meniere's diseases, and certain sudden onset hearing loss conditions can also be associated with this condition called tinnitus. Neurological diseases like multiple sclerosis and other degenerative age related hearing losses, and also certain conditions like palatal myoclonus and brain tumors can also be associated with tinnitus. So there are some psychological disorders in which the auditory hallucinations are very common, and these noises can also be heard by this particular individual. So sometimes pulsation kind of sensation in the ear or a noise like pulsation, something like heartbeat like sounds can also be heard. So these conditions are very common blood flow sounds most of the times, but very rarely they can be because of arterial and venous malformations. So a thorough clinical examination and few tests like video otoscopy, audiometry, CT and MRI scans can diagnose the underlying cause of the tinnitus, and the treatment will be treating these underlying conditions can relieve tinnitus in most of the cases. But there are certain disorders in which the apparent cause is not identified. So in these conditions, tinnitus retraining therapy and tinnitus masking can help relieve the tinnitus. Thank you so much for being with us in understanding the most common ENT symptom called tinnitus.